Okay, the next thing I'd like to show you is the Problems tab. So I think as a whole, this is probably an underutilized part of CPRS. And depending on whose panel you take over or which patients you take over, there is a lot of variation between which attendings keep this up to date and which do not sort of use it. So the problems tab is a running list of all of the issues that your patient has. So you can see here there's a number of issues that have been entered for Cheesy ZZ Mouse. And I like to keep this nice and short as possible, and really only things that are really important that somebody who doesn't know the patient, who might be just looking through the chart, I would like them to just be able to get a quick view of the patient and who they are. So I think this can be helpful not only for yourself to get to know the patient, but also as a resource for others who are going to be seeing your patient as in consultation. So if you look at this list here, there are a lot of things in here. Uh, you know, some of these I would take off myself. So screening for malignant neoplasms of the skin. So I would click on that, and then I would click the remove button because I don't feel that that's really important to have in a problem list. So I would remove it, and then it goes by. So here are some that I definitely would keep. So lack of housing, and then you annotate it, sleeps in his vehicle, migraine with aura, cluster headache. Those are important. Acute pharyngitis. I don't know that it's that important that people know that he had acute pharyngitis in 2013. So I would click the remove button. If you'd like to add a new problem, you would click on new problem. These are a bunch of the most popular or common. If you don't, so for instance, let's say I wanted to add coronary artery disease, I would click on it. And if I just want to add it as is, I would click OK. If I want to tell you a little bit more about it, you can click the add comment and you can say status post cabbage in 2017. And you would click OK, and now you can see that not only coronary artery disease, but it gives you a little bit more detail about this. If there are things that happen down the road, you can always add more. So you can do annotate, you can do status post PCI in 2020, just so it gives you a little bit more information. Now, if you don't see a problem, you can also do other problem, and then you could type it in yourself. So let's say he has hemochromatosis. So you would hit OK, and then it will be added to your problem list. And so I really encourage the first time you see a patient to sort of look through the list, clean it up, add things, subtract things, try to keep this as nice and fresh as you can. And that is how we use the problem list.